Finally, an end to that case, Dave. All right. Well, medical experts say workplace violence from hospital patients has been on the rise in the last 5 years, sometimes driving workers away from the profession.
Taylor Johnson joins us live with a bill that would expand who is protected from attacks. Taylor.
Aaron and Jacqueline, from security guards to dining staff, anyone working in a hospital could run into this problem. That's why hospital leaders are calling for more legal protection.
This sign in the lobby of CHI Emmanuel Hospital comes with a warning. Assaulting a healthcare worker could lead to a felony charge. The hospital's president says these incidents happen more than you think.
People getting patches of their hair ripped out, or people, a couple weeks ago, getting spit on and different things like that. It's becoming more and more prevalent in healthcare.
Experts say healthcare workers like doctors and nurses aren't the only ones getting attacked.
It could be somebody in housekeeping or facilities, dining, who happens to be in the room and could sustain an injury due to a violent episode.
That's why a bill in the unicameral would expand who is considered a healthcare worker for legal protection, including pharmacists, public safety officers, and those working in hospitals.
The bill itself is not going to be some kind of panacea that's just going to all of a sudden solve workplace violence and nobody's going to harm anybody. But I do think it does a good job of representing all staff and making sure all staff feel safe.
The Nebraska Hospital Association is advocating for the legislation. In addition to legal protection, they're providing other ways to remedy the issue.
We're trying to give the healthcare workers the tools and resources to do anything they can to manage and de-escalate any potential violent situations.
And as a leader, Ashby says he's doing his part to support his staff.
I'm a caregiver to the caregiver, whether you're directly taking care of patients, whether you're working at the hospital and taking care of the people that take care of the patients. I take that very seriously.
The bill did make it through the first round of voting, but there is some opposition to it. A state leader we spoke with tells us they don't believe new sets of felonies create safety, but rather it worsens the problem by potentially sending more people to prison. In the studio, Taylor Johnson, First Alert 6.